You've arrived at the scene with a 45-year-old male who has chest pain.
Okay, no worries at all. Is the scene safe?
Yes.
Okay, excellent. So my partner and I are wearing our full uniforms, safety boots, gloves, glasses, and we're ready to go. So I'll just knock on the door.
Hello.
Hello, you've called an ambulance today?
Yes, my husband has, he's 45 and he has chest pain on the left side of his chest.
Okay, no worries. We should go in. Are there any animals inside?
No.
Okay, lovely. Let's go in and have a look at him. G'day mate, how are you?
Yeah, good.
Excellent. So car CSU 1 to Northern Control.
Go ahead, car CSU.
Thanks, CSU car 1. We're at 12 Heron Place at Lakewood, where we've come to a 45-year-old male with chest pain. No hazards. Access by the front door. We're on the first floor. One patient who is conscious and breathing, and we'll have emergency services at the highest clinical level, please.
Copy.
No mate, so why have you called us today?
I've got some chest pain.
Oh, well that's no good. Listen, before we go that, I just want to assess a few other things and then we'll talk about your complaint if that's okay.
Yep.
So I can tell you're conscious because you're answering me, you've been tracking me through the room, which is awesome.
Yep.
You're answering all my questions, which is great. You also I can hear that there's no funny noises in your airway, there's no restrictions in your airway, which is good. Means your airway's open. You're a great colour. I can see that you're breathing. You're well perfused as well. So ABCs are looking really good. Can I get you, please, partner, to take a respiratory rate and then a pulse rate for me?
Yeah.
Okay. And once she does that, I'm just going to use my stethoscope and just listen to your chest, just in a couple of places. That's all right.
Yep.
Breathe in and out. Excellent. Your respiratory rate is quite good. Just going to quickly feel your pulse. And your pulse is really good too. Okay. So I'm going to classify you as a potentially unstable patient. We're going to need to do a couple of things just to make sure everything is good. Can you tell me what day of the week it is today?
It is Monday.
And what month are we in?
We're in April
What's the year?
2020.
Do you know the name of our Prime Minister?
That was Scott Morrison.
There you go. You were going to say ScoMo then, weren't you? Do you know the name of the American president?
Yes. Donald Trump.
Okay. And what's the name of your school principal?
Mr. Hughes.
Okay, excellent. That's great. So I can tell that you understand where you are and all that sort of stuff, which is really good as well. Give me your hands. Just put those down. Squeeze my hands. Excellent. Feet flat on the ground. Heels on the ground. Push up. Excellent. Good job. And I'm just going to get your notes for you so you can remember where we are. There you go. Okay. Righto. I'm not going to bother exposing anything like that, but you do feel, as I felt around, you do feel quite good, which is great. I just want to ask a few questions if that's okay.
Yep.
So why have you called us today?
Because of chest pain.
Is there anything else?
Yeah, it goes into my back, left shoulder, and neck and arm.
Okay. Is there anything else?
I feel short of breath.
Okay. Is there anything else?
No.
No, that's all?
Yep.
So you have pain in your chest.
Yep.
It goes into your back, into your neck, and down your left arm.
Yep.
Okay. And you feel short of breath as well.
Yep.
And there's nothing else.
Nothing else.
Okay, cool. No worries at all. So there's no other signs and symptoms that we need to worry about.
No.
Are you allergic to anything?
Yes, penicillin.
Penicillin? Okay, no worries at all. Do you take any regular medications?
Yes.
Ramipril and Crestor?
Yeah.
Okay. Excuse me, would you be able to go and get his medications for me so I can have a look? Thank you very much. So what is your past medical history?
High cholesterol and blood
Thank you.
pressure.
So high cholesterol and high blood pressure. I'll look at the medications in a moment. Okay. And so when was the last time that you ate?
It was breakfast this morning.
Okay, no worries at all. And this pain that you got, what was going on? What was happening before this happened?
I was mowing the lawn when I got this pain. I had to come inside and sit down.
Oh, did you?
Yeah.
Okay, so it was pretty severe. It stopped you.
Mm.
Wow. Okay. So what's the pain like?
Heavy like an elephant sitting on me.
So it's a really heavy pain in the left side of your chest,
Yep.
and it's like an elephant sitting on top of you. Okay.
Yep.
Now you told me that the pain goes into your back,
Yeah.
into your neck,
Yep.
and jaw. Does it go anywhere else?
My arm.
In your arm as
Yep.
well, down your shoulder into your arm as well. Just
Yep.
your left side?
Yep.
Yeah?
Yep.
Awesome. Okay, no worries at all. Out of 10, if I said 0 was nothing and 10 was the worst amount of pain you've ever felt,
Yeah.
what would you give for this?
7.
7, that's pretty severe.
Mm.
I didn't ask, does anything make this pain better or worse? Nothing makes it better and nothing makes it worse?
No.
Okay, so yeah, righto. And so it was 7 when it came on, it's just stayed there.
Yeah.
Okay, no worries at all. And what time did all this start?
11.
11 o'clock.
Yep.
Okay, no worries at all. How'd you go with the pulse rate and the rest rate?
His rest rate is 16 and his pulse is 92.
Excellent. Can you please take a full set of obs for me? I'd like blood pressure. I'd like his SpO2 and his pulse done again. SpO2 to do it on the monitor is fine. His temperature and his blood sugar. Can you do those for me?
Yeah.
Once you've done that, I'll get you to give me the leads to the monitor and I'll hook them up for you.
Yeah.
Okay, so just want to have a little bit of a chat about your social history. Are you working? Are you employed?
No, I lost my job because of Corona.
Oh, geez, that's no good, mate. I'm sorry to hear that. How about your diet? Do you eat well?
I eat a lot of takeaway food.
Oh, okay. What about exercise? Are you an exerciser?
No, I don't believe in it.
Okay, all right. Have you been overseas? Any overseas travel recently? No. And what about any like long trips? You've been anywhere in the state lately? Anything
No.
like that? Okay, no worries at all. Are your parents still alive?
Yep.
Oh, that's good. And what about brothers and sisters? You have brothers and sisters?
Yeah, 2 brothers and 3 sisters.
And are they still alive?
Yep.
Okay, that's excellent news. All right. Do you smoke?
Yes, 20 per day. Ever since
No.
I was 16.
30.
30 a day? So it's a bit of a fear. How about drink? Do you drink much alcohol?
Yeah, normally 2 to 3 beers each day.
About 1 to 10 or
But-
10 to 20.
10 to 20? Wow, that's a little bit different, isn't it? Okay, no worries at all. Okay, look, what I want to do is I just want to go through and do some further assessments. Charlie's taking some obs at the moment,
Yep.
just to tell us what's going on. We're going to get the monitor on. While she's doing that, I'm going to just check a few other things out. Is that okay by you?
Yep.
Would you mind taking your shirt off so we can get a good assessment of you?
Wouldn't at all.
Excellent. So to start with, I just want to have a look at your fingernails if that's all right. And what I'm doing is I'm looking for any clubbing in your fingernails, any cyanosis, any nicotine staining, which I can really see on that hand, any splinter hemorrhages, which I can't see. So apart from the nicotine staining, I can't see anything else. So that's a really, really good sign to start with. I'm looking at your chest. Can you take a big deep breath in for me? And I've just seen, and let it out. Let it out, yeah. So I'm just noticing that it's symmetrical and there's a nice, easy rise and fall of the chest. I'm looking to make sure that there's no scars, and there's no scars there at all. I'm just going to feel, and I'm just noticing that you're a good colour and you're quite a nice temperature as well, which is really important as well. I just want to look at your eyes. Just have a look at me. Okay, just want to look in your eyes. So I'm just making sure that there's no conjunctival pallor. Just looking for any growth underneath your eyes, because you did say you have high cholesterol. There's nothing wrong with your cornea as well, which I can't see anything. So that actually looks really good as well. So far we're looking pretty good. So we've already done your rest rate, which is good. And the only other thing, I just want to press around. Does that hurt at all? No? Excellent. Okay, so your abdo's looking pretty good as well. Righto, so I just want to have, now I want to palpate your chest. Can you tell me, does that hurt at all?
On the left side, yes.
Does it hurt worse when I push down on it?
Yeah. No.
No? Okay, excellent work. Can you turn around just so I can have a look at your back? I know I'm saying I'm assessing your chest, but I'm going to do it through your back. Right, that's it. And big breath in. Breath out. Okay, do it again. Big breath in. And breath out. Okay, excellent. Can you say 99?
99.
99.
99.
And again.
99.
And again.
99.
Excellent work. Thank you very much. Just while you're there, I'm just going to listen. Deep breath in. And out. And 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 in. Excellent. Turn around to the front, please. Okay. And in. And out. And. And again. And again. Okay, excellent. I'm just going to listen to your heart now.
Yep.
So you just breathe normally for me, okay?
Yep.
And it's going lub-dub really nicely, which means your heart's working quite well. The only other thing I'm going to do while I've got this out is just listen to your stomach. Excellent, that sounds really good too. Okay, now what I haven't done, which I should have done earlier, is I just need to percuss your chest just to listen. So I'm going to do that twice or 4 times in the front here. Can you turn around so I can do it on your back?
Yep.
Excellent. Excellent. Okay, that didn't hurt at all, did it?
No.
Excellent work. Okay, so just the other thing I just want to do is I just want to push against your legs there. There's no swelling in your legs at all, which is really, really good. Thank you. Have you got the stickers as well for me? Okay, so it's good that there's no swelling. So the final thing that I need to do is I'm just going to attach this ECG to you.
Yep.
Thank you very much. Charlie, can you tell me, please, what obs that you might have?
His rest rate is 16, BP 120 on 80, his pulse is 92, SpO2 is 96%, ECG is sinus rhythm.
That's excellent timing for that sinus rhythm, which just shows to everyone that yes, it is a sinus rhythm. Well done. Awesome.
And his temperature is 36.7 degrees.
Excellent. Okay. Well, thank you very much for that. So I think what we need to do is we need to take you up to hospital. You don't need any oxygen at the moment because you're not hypoxic and your oxygen saturations are quite good. But we should go up to hospital and investigate this chest pain. We don't have backup here as yet, but when they do turn up, they might meet them en route and to join us in hospital. Are you okay with that?
Yeah.
That's fine?
Yep.
Okay, no worries at all. So now I'm going to take the opposite. My partner's written down so kindly for me, and we're now at hospital, and I need to give a handover to the nurse. So there's my nurse. All right. G'day, how are you today?
Doing all right yourself?
I'm going very, very well, thanks. So I have with me 45-year-old Bob, who's had an acute onset of left-sided chest pain, described as heaviness, which radiates to his shoulder, jaw and down his left arm. Started around about 11 o'clock this morning. He's had no relief from this. His obs are all within normal ranges, but he has a rest rate of 16. His blood pressure is 120 on 80. His heart rate's 92. His SpO2 is 96. His ECG is a sinus rhythm. His temp's 36.7, but he does describe this pain as 7 out of 10. He's allergic to penicillin. He takes Ramipril and Crestor for high blood pressure and high cholesterol. We haven't been able to offer him any treatment at the moment because I'm only qualified to give him oxygen, and backup hasn't met us at all as yet. And some other information for you: he does have a high alcohol intake, and he is a 30-a-day smoker. We've left his wife at home. She'll call you later on. Is there any questions at all?
Nope, not at all. Thank you.
Excellent. And that's it.